Nurse Sherry here, and today we're going to be going over how to transfer a patient with a sit-to-stand. So this is your sit-to-stand machine, and this will help transfer people who have some ability to stand, but maybe not full ability. So they have to be able to have some sort of weight bearing on their feet in order to use this. So if they don't have that, then you'll want to use a Hoyer lift for your transfers. Okay, let's get started. So before I would do this, I would obviously wash my hands, provide privacy, and I'll come in and introduce myself to the patient. So hi, my name is Sherry. I'll be your CNA today. Can you verify your name for me, please?
Taylor.
Hi, Taylor. I'm here to transfer you from the bed to the chair. Would that be okay with you?
Yes.
All right. First off, we're going to look at the sling. When you go to put a sling on someone, you should inspect your sling. Sometimes each patient has their own sling, and sometimes you're using one for multiple people. If you are, you need to make sure that you clean this in between each patient so that you have a nice clean one before you do it, as well as a machine, and I'll show you how to do that afterwards. You want to check all of your the bindings here and just make sure that there's no tears or anything and that everything is going to work good. I always like to make sure I measure this around my patient, which I already did, to make sure that this is going to fit her. So this is a good size for my patient. So you always want to make sure that you have the correct size for your patient. All right, so the first thing I'm going to do is take my sling, and if you can look, you can see this is going to go upwards like this. My pieces on the inside are going to go what goes around your patient. So this is going to be the proper way to place it around my patient. All right, I'm going to go ahead and put this around you and get you nice and buckled in. So I'm going to take this piece and this piece, and I'm going to go ahead and buckle it. And you want it pretty snug because you don't, it's kind of like a gait belt. You just want to be able to put your two fingers in between the skin and the patient. All right, now that I got this, I'm going to go ahead and make sure that my patient has shoes on, which she does, but they should definitely have shoes or non-skid footwear when they're getting into the sit-to-stand. Okay, so I'm going to ask my patient to lift up her feet as I go underneath of her with the machine. And then I'm going to go ahead and ask her to place her hands up here just so that I can view and make sure I got a good, proper position for when I lift her up. Then I'm going to go ahead and lock this because I don't want it moving out of the way when I transfer my patient. Then I'm going to make sure the bed is locked. I'm going to take this and I'm going to go under the arm. So this is going to go up under the arm. And I'm going to go ahead and use the blue one on this one here. So I'll have you move your hands right here. And then I'm going to take this one and I'm going to use the blue one right here. And you want to make sure that it's under the arms. This will help them as you lift up. Okay, then I'm going to go ahead and take the remote, which is right here, and I'm going to power the machine on by hitting this red button. And you just want to make sure that you watch your patient as it goes up, making sure that they have something to hold on to and that it's going to assist them in a standing position. This should be at their knee length, which I measured it prior to having her come on, just to make sure it was in a good spot for her. All right, now that I got her here, I'm going to go ahead and unlock it, and I'm going to move this gently and to the side. Alright. Then I'm going to open the legs up. So on the machine, it has where you can open the legs up or close them. So I'm going to open those up. That way they go around the chair so I can get the patient in there. Okay. Go ahead and go at the back to where their knees are fitting the back. And I'm going to go behind the patient and just make sure that she's sitting in the back part of the chair as it goes down. So I'll grab the bottom portion. Okay, and here we go down. And then I'm gonna go ahead and undo this portion first and undo this side. And then I'm gonna go ahead and have her take her hands off of here. And I'm gonna move this back a little bit and I'll lift your feet up afterwards. If you can lift your feet up, go ahead. If they're able to lift their feet up, go ahead and allow them to, which they should be if they're, if they can bear weight. All right, then I'm gonna go ahead and take this off. And I'm gonna make sure that my patient is comfortable. Let's scoot back. Okay. And here's your call light. Is there anything else I can get for you?
No.
All right, thank you. All right, and then after I'm done, when I take this outside, I'm gonna go ahead and clean it. So whenever you're cleaning any items, you use like these hospital wipes or whatever cleaning wipes, you should make sure that you wear gloves because what goes on your skin goes in your skin, into your system, and these are extremely toxic. So I grab a few of these, and you're gonna wipe down the entire machine. Because this was in a patient's room and we used it on a patient. And so we should clean these in between each one. This should be cleaned or it stays in the room with the patient. So if I was gonna take it off, then I would just clean every area of this machine with these wipes. And that will ensure that I don't have any nosocomial infections. All right, thanks for watching.